Good day, my dear students, future nurses. In today's discussion, we will tackle the historical development of psychiatric mental health nursing. We will examine how past societies viewed and dealt with mental illness. Likewise, we will take note of the significant changes in psychiatric mental health nursing from an era of an inhumane treatment to a deeper understanding of human behavior and the application of science in the management of patients with mental illness. In this segment, we will discuss the history of psychiatry, and as we discuss this, we will traverse the different era, and this will be as follows. First, we will begin with the prehistory, then it will be followed by the ancient world. We will continue with the Dark Ages and proceed with the Middle Ages and Renaissance, then move to the modern era, and last is the age of managed care. Let us now begin with the prehistoric period. And for you guys to fully appreciate this era, I want you to look at the images at your right. And by the way, these clips were lifted from the articles discussing this era. The first image that you are seeing will give you an idea of how people with mental disorder were treated during this time. Next is an image that depicts evil spirit and demon possessing and controlling a person. Now take a look at the succeeding images. It's quite scary, but these images were old demon concepts. During this period, it was believed that mental illness was due to supernatural forces of God's punishment for their sin and wrongdoing, or it could be from spirits such as dead ancestor, as primitive culture believed that when a person violates their spiritual rights or tradition, their dead ancestor were disturbed. And it could also be from demons. This demonic possession was believed to occur when the person engaged in behavior contrary to the religious teaching and the religious rituals. Primitive man could not differentiate between magic, religion, or medicine. Primitive culture also believed that spirits spoke to man through shamans. Now, what is shamans? Shamans during the time are practitioners, and they have the ability to connect to the other world, and they have the power to heal the sick through communicating with spirit. And they are asking the spirit to leave the body of the sick person. Now let us proceed with the treatment of mental illness during this era. In this image, you can see that during the Stone Age, cave dweller talked to spirit through spiritual rituals. Another way to treat mental illness is through exorcism. So primitive culture used this treatment in which evil spirits were cast out through prayers, magic, flogging, starvation, making noise, or having the person ingest horrible tasting drinks. It was also during the time that persons with mental illness were burned, beaten, and amputated. Another way to treat is purging. So purging is being done to effect a cure to patient with mental illness. Next to purging is operation or trepanation as one of the treatment during this period. Now guys, please try to look again at the clip, and can you describe the image that you're seeing? Okay, I bet you also observed that there is a hole in the skull. Also in these archaeological artifacts, this image depicts trepanation. So what is trepanation? Trepanation is a procedure in which a stone instrument known as trepine was used to remove a part of the skull, creating an opening. So during the time, they believed that through that, the evil spirit could escape through the hole in the skull and thereby ending the person's mental affliction. From the prehistoric period, let us now move to the ancient world. Please take a look again at the video clip and identify significant personality and their contribution.
Hippocrates Hippocrates, the father of medicine, was a Greek physician from classical Greek, the first documented chest surgeon, but also the first to introduce the concept of mental illnesses. His theory was an imbalance of humors, defined as bodily fluids, black bile, yellow bile, phlegm, and blood. When the humors were out of balance, the patient's personality, physical, and mental health were affected.
So from this discussion, we can tell that practice of mental health is quite old. It was actually first introduced by Hippocrates, who first conceptualized mental disorder. It was during the time of Hippocrates when he rejected the idea that mental disorder was due to demonic possession. Instead, he said that it was due to physical disorders, and mental disorders had natural causes. So Hippocrates attributed mental illness to increased humidity of the brain. Particularly, he suggested that these mental disorders arose from brain pathology or head trauma or brain dysfunction. He also described four main fluids or humors that direct normal functioning and personality, like blood from the heart, black bile that arise from the spleen, yellow bile from the liver, and phlegm from the brain. And any disturbance of this humor or body fluids results to patient's personality, physical, and mental health were affected. Let us continue the clip.
This theory drifted away from the belief that people became ill due to the wrath of gods, as that was the way they were usually seen in Greece, Egypt, and Mesopotamia. Escalate was the first to distinguish between hallucinations, illusions, and delusions. He stressed the importance of environmental causes for mental illnesses and recommended more relaxing treatments opposed to bloodletting and restraints. Soreness suggested treatments that would exercise the mind, such as
There you go. So even that period, they could already distinguish illusion, delusion, and hallucination. And take note, they also stress the importance of environmental causes of the mental illness. They also suggested that a more relaxing treatment would be necessary as opposed to bloodletting and restraints. And they also suggested during the time that, particularly from Serranus, that treatment would be to train the mind, such as having patient participates in discussion with philosophers to cure their fears. And while Gallen saw clinical symptoms of depression in neurologic system or structure malfunction. Other than this information, in pre-Christianity years, the priests acted as magicians, physicians, and psychologists, and magical treatments were carried out in temples. From the ancient world, let us move forward to the period of Dark Ages. Let us find out how mental disorders were viewed during the Dark Ages and how they were managed. And here's a clip to give you an overview of this period.
the most widely believed philosophy during the Middle Ages. The soul governed the body. This belief was influenced heavily by the religious influence of the churches and led to the scientific findings from Greece and Rome being forgotten. Nicholas Orsay, a significant philosopher in the late Middle Ages, thought that demons were the cause of most mental illnesses, a not uncommon theory at this time. Other than demonic possession, witchcraft, hysteria, and stress were all causes of mental illnesses. Treatments for the illnesses include exorcism, hearing mass, and drinking a cold glass of water.
With this discussion, we can say that the church has also a valuable contribution in practice of mental health. And similar to the primitive time, they believed that mental illness were caused by demons, possession of evil spirit, witchcraft, hysteria, and stress. Thus, the treatment are like the old times. That includes exorcism, hearing mass, and drinking of cold water. This treatment were being done during the time to make demon uncomfortable so it would leave the body. And when this is not managed with this intervention, they would afford the service of a doctor, particularly the affluent family. Again, in this era, it was believed that the cause of mental illness was due to possession by evil spirit. By the time Christianity became an official religion, this demonic belief was an essential part of the faith. And Galen systematized all previous medical knowledge about mental illness. So that's it with the Dark Ages. And in the next slides, we're going to discuss the Middle Ages and the Renaissance period. This is the Middle Ages and the Renaissance period. In the 15th to 17th century, there was a continued skepticism on curability of mental illness. Asylums became the repositories for prolonged enclosures. It was also in this era that mental illness was distinguished from criminals. Dangerous lunatics were thrown in prisons, they are chained and they are starved, while the harmless were actually allowed to wander. Also in England during this time, or during the time of the Renaissance, Bethlehem Hospital was declared a hospital for the insane. And during the late 1775, visitors of the institution were charged for a fee for a privilege of viewing and ridiculing inmates who were seen as an animal. Thus, during this time, they concluded that insane people were treated more like animals than human. They were poorly clothed and fed, they are chained and caged, and they are deprived of sunlight. To give you more information on this period, here's another video clip accounting the events in this era. So please take note of the significant information.
In the beginning of the 19th century, a German physician, Johann Ryle, coined the term psychiatry. Dr. Ryle wrote about the suffering of the insane in asylums and developed treatment methods. He made the observation that suicidal patients who tried to drown themselves but survived often appeared to be temporarily cured. Thus, when patients seemed unresponsive, Dr. Ryle would dump them under water or try to revive them by dripping hot wax on their hands or placing mice on their skin. Dr. Ryle believed that in addition to nervous system dysfunction, advances in civilization contributed to madness. Like other doctors of that era, however, Rush's treatments included bloodletting, purging, hot and cold baths, mercury, strapping patients to spinning boards, and tranquilizer chairs. These crude treatments and array of medications did little to improve the lives of persons with mental illness.
What is notable in this clip is where the contribution of Johann Ryle, who coined the term psychiatry, and his expose about the suffering of the insane and the suffering, likewise the treatment method he developed after his observation of suicidal patients, such as dumping patient under water, dripping hot wax on their hands, placing mice on their skin. So the treatment were quite harsh, and he postulated that mental disorder was due to nervous system dysfunction and to advanced civilization. It was also important to note that during this era, they continued to use bloodletting, purging, hot and cold bath, use of mercury, strapping patient to a spinning board, and a tranquilizer chair was used. However, these treatments were found to be ineffective in improving the lives of the mentally ill. So these are the important information in this era. In the next slide, we will discuss the modern era. Let us now proceed to the modern era. So modern era is particularly described as the period with more humane approach in the management of patients with mental illness. Particularly in the late 18th century, it led to the advent of moral treatment, which was characterized by kindness, compassion, humane treatment of mentally ill patients. This is actually seen in the work of Dr. Benjamin Rush at Pennsylvania Hospital in America, where he developed a more humane approach to treatment by employing attendants who are sensitive and intelligent. And these attendants are advised to work closely with patients, and they are encouraged to constantly read, talk with patient, and took them to walk. In fact, they also encourage doctors to give gifts to their patient. To have a full understanding and appreciation of this era, please watch the film and process the information.
Moral treatment was an approach to mental illness based on humane psychological and social care, with pleasant and routine environments coupled with moral discipline. This treatment model had existed in ancient cultures, but faded. In 19th century Europe, moral treatment resurfaced in England under non-medical Quakers, and in France and Italy under physicians Pinel and Chirurgi. The York Retreat in England used primitive affective conditioning to achieve cures. Debates existed over whether the cures were medical or spiritual. In either case, less harm came to patients.
Okay, with that, we could say that during the 19th century, treatment were based from psychological, social care with pleasant environment, and they are coupled with moral discipline. And they are actually using primitive effective conditioning, and they are considering which treatment were less harmful to the patient. In the 20th century, there were two opposing views regarding mental illness. One is biological view, stated that mental illness was due to biological causes and it could be treated with physical treatments. Second, psychological view stated that mental illness was due to factors such as social stresses. So these are the important information in the modern era. We will now move to age of managed care. From the modern era, let us move forward to the age of managed care. Here's a clip to give us an insight.
In the 1840s, a New England school teacher, Dorothea Dix, shocked people as she drew attention to how terribly society treated citizens with mental illness. Miss Dix was a disciplined Puritan with strong beliefs about treating others with love, kindness, and human dignity. She lectured state legislatures and citizens in every state east of the Rockies, painting vivid pictures of the mentally ill in chains, sitting in their own filth, and having no access to kindness or medical treatments. They gathered at the Jones Hotel in Philadelphia to form the Association of Medical Superintendents of American Institutions for the Insane. During the next 80 years, the group expanded, and in 1921 became the American Psychiatric Association. The American Psychiatric Association's logo bears the image of Dr. Benjamin Rush and the year 1844. Dr. Rush was one of the signers of the Declaration of Independence and is considered the first American psychiatrist.
And that's it. What is notable in this narration were the contribution of Dorothea Dix, who was a teacher and an author, and she is always remembered, or will always be remembered, because of her advocacy of reforming treatment of mental illness. As mentioned, she wants others to be treated with love, with kindness, and human dignity. In addition to her contribution in psychiatry, it's also important to note that she was an instrumental in shaping the nursing profession, especially the mental health. We also have to remember that a group of men gathered to form the Association of Medical Superintendents of American Institution for the Insane, which later on expanded, and in 1921, it became the American Psychiatric Association. And during the time, Dr. Benjamin Rush was recognized as the first American psychiatrist. Other than this information, here are some significant details in this period. Mental health care is managed separately from general health care. The emphasis is on reducing institutionalized care of patients with mental illnesses and treating them in community settings such as clinic, home, and schools. So at this time, there is already a deliberate shift from institutional care in the state of hospital to a community facilities. And most of the time, people receive care based on their needs rather than on requests. And preventive and promotive psychiatry is also on the rise during this period. And that's it for the age of managed care. Next slide, we are going to discuss the early history and evolution of psychiatric nursing. And now we're going to discuss the early history and evolution of psychiatric nursing. The history of psychiatric mental health nursing, although the specialty of psychiatric mental health nursing is now well integrated into mainstream nursing practice, it retains a unique history. So the following is a chronologic listing of some important events influencing psychiatric nursing, and there you go, the historical overview. In 19th century, the need for psychiatric mental health nursing was recognized. 1882, the first school of nursing in psychiatric setting was established at McLean Hospital. Then in 1913, Euphemia or Effie Jane Taylor, who worked with Adolph Meyer, initiated the first nurse program. 1920, first psychiatric nursing textbook, Nursing Mental Disease by Harriet Bailey, is published. 1925, Indian Mental Hospital was built at Ranchi. In 1930, principles and practice of psychiatric nursing were derived from practical experience of caring for the psychiatric patients. 1935, insulin shock therapy is introduced. In 1936, psychosurgery. 1937, electroconvulsive therapy for treatment approach is introduced. In 1943, the Madras government organized 3-month psychiatric nursing course at the Mental Hospital, Madras, and it stopped in 1964, training only male nurses instead of midwifery. In 1946, National Health Survey leadership of Sri Joseph Bohr Committee report urgent need to look after the mentally ill funds available. Prepare psychiatry, psychology, social work, and nursing. Then, 1952, Hildegard Pepolo published Interpersonal Relations in Nursing. So, this is a text that provided the basis for the development of therapeutic role in a nurse-client relationship. In 1953, Maxwell Jones published The Therapeutic Community in United States of America, which is influenced by the Indian psychiatric nursing. Then, 1955, the Joint Commission on Mental Illness and Health was developed to study and evaluate needs and resources. In 1961, the World Psychiatric Association examined the social consequences of mental illness. 1963, Perspective in Psychiatric Care published Journal of Psychiatric Nursing and Mental Health Services were published. In 1965, the Indian Nurses Council included psychiatric nursing as a compulsory course in Bachelor of Science in Nursing program. In the year 1965 to 1966, psychiatric nursing component was added in General Nursing and Midwifery course. And then in 1967, the Trained Nurses Association of India formed a separate committee for psychiatric nursing to improve the perspective of psychiatric nursing. 1975, psychiatric nursing was offered as an elective subject in Master in Science Nursing at RAC. In 1979, Issues in Mental Health Nursing is published, and in 1980, the first edition, Principle and Practice of Psychiatric Nursing, by Stewart and Sudden, is published. In 1986, the Indian Nurses Council made psychiatric nursing a component of general nursing and midwifery course. And then in 1990, Standard of Psychiatric Nursing is published also. And then 1991, International Council of Nurses declared the year for mental health nursing. In 1991, psychiatric nursing expert and psychiatric nurses of National Institute of Mental Health and Neuroscience, Bangalore, formed an association as the Indian Society of Psychiatric Nurses. In the year 2000, there is already a revised scope and standard of psychiatric mental health clinical nursing practice published by the American Nurses Association. In 2003, there is already a certification of psychiatric nurse practitioner by the American Nurses Association. In 2006, there is evidence-based practice, and in general nursing and midwifery, there is separate paper, theory, and practical. So that's the history and development of psychiatric mental health nursing. With all of this information, we could say that there has been a great leap from the history, from the prehistory to the present in the practice of psychiatry and mental health nursing. So that's all, folks.